start that. And then I'll take this opportunity to turn it over to our colleagues from MDHHS and Doris Crandall. Is that all right? Or whomever you'd like to have start first.
Okay. Well, my name is Doris Crandall. I work in HR as a recruiter for Michigan Department of Health and Human Services. My main focus is the human services side of the department. So I mainly recruit for what we call our services specialist position that works in those county offices doing child protective services and foster care. I'm joined today by Alan, is it Tepe? Did I pronounce it correctly? Or...
T. That's close
okay.
though, it's good. It's good enough.
Okay. I'm joined today by Alan. He's with St. Clair and Sanilac counties. And he works in the child welfare field there. So he's going to talk about the ins and outs of the actual position and the day-to-day. I'll let him go first, and then I'll talk about how to apply, how our interview process works, and all of that. I also have Samantha Rule here with me today. She's my co-recruiter. She recruits for the healthcare side of the department. We also hire social work for that side of the department also, mainly master's degree level, and they work in our psychiatric hospitals. So we're happy to be here with you guys today. I'm also going to put in the chat box a Google Docs sign-in sheet that we have. So if you're interested in keeping in contact with us and getting more information, please feel free to put your information in that document. So I'm going to turn it over to Alan and let him go first because he's got the more exciting part of the presentation. Mine's a little dry with all the ins and outs of how-tos. So I'm going to turn it over to you.
Thank you. Hi, everyone. My name is Alan Teep. I've worked with the state of Michigan for about almost 6 years now. I'm here with MDHHS for almost 3, about 2.5 right now. And I don't see myself ever leaving the state. I would like to stay with MDHHS. I really like the agency, the benefits and the people I work with, and the direct contact that I have with the communities that we serve is very rewarding. With that said, I'll get into the job itself that you're most likely interested in. With child protective services, there's a few categories of work there. We have investigative, ongoing, and foster care casework. With investigative, a referral comes in, it is then assigned to a CPS worker. The worker would then interview the children without the parents present if possible, and go through the investigation to see if it is substantial to go forward with an ongoing casework. If there is ongoing evidence that there is abuse or neglect of some sort, where it would go to an ongoing caseworker. From there, it gets forwarded to an ongoing caseworker, and it's assigned to have a closer look to see if the children should be removed from the home. These cases require more supervision than regular CPS cases, such as the initial investigation caseworker would go through. And when it is escalated to this, then it would then get escalated to the foster care case when the children are actually then removed in order to keep the children safe while the parents work to correct the problems that were then cited in the initial and ongoing casework. So there's 3 parts in that you may be placed into when you initially apply for CPS. It could be investigative, where you have more of like a high turnaround, where you're doing the initial investigations, looking at what's going on with the family, and then seeing if it needs to be escalated to an ongoing case flow, which is the second one. The second step is an ongoing caseworker. And then thirdly is the foster care, where you're placing the children in foster homes. And then along with child protective services, we also have adult protective services on that side. And it's similar that they have staff that do investigations, they go through risk assessments, conduct interviews with the client. And right now with COVID, things are really interesting. Instead of going in person for a lot of them, there's more phone-based. Being more tech savvy is great, and being innovative in your ideas and how to get those meetings and investigations done. With that, there's also ACP and ILS. With ACP and the adult protective services, that goes into looking at home health providers, placement in adult facilities, and then the ILS is home help within the home that gets placed. And then on top of regular work within CPS and APS, there's also a great deal of extracurricular, I guess, activities that you can do within the state. Right now we have DEI teams, which are diversity, equity, and inclusion teams that you can become a part of, where we look at diversity and equity and inclusion within not only our own department, but also within our communities that we serve. There's funds and employee engagement committees where we look at trying to keep the office as upbeat and motivational as possible and just a fun place to work. We also have workforce transformation committees where we work towards improving policies and procedures in place to back staff more and help staff within their positions that they serve. With that, does anybody have any questions regarding any of the positions or working within the state?
Folks can feel free to put their questions in the chat box if they wish, or they can unmute and ask the question, either way.
And then we'll say with applying, I asked managers for what they look for in an interview. And right now, a lot of interviews are being held via Teams or Zoom or Skype, but mostly Teams is what the state uses, is Microsoft Teams. And what they look for is being energetic, client service oriented, having the ability to change direction often, indicate the ability to remain calm under pressure, express a comfort with staying in consistent state of learning, of course, good communication skills, and great attention to detail. And right now, I will say just about all of our staff, 99% of our staff are working remote, are working from home right now. We're looking to change that. I think in March, we're going to slowly start putting people back into the office from what I'm aware of. But adult protective services, child protective services, and even our program side of the state are working remote from home. And expect that when you do work in adult protective services and child protective services, that you should be able to work closely with programs staff to look at what kind of programs the family are in. We have program staff that work inside of schools. And so there's a lot of hands-on within the community and a lot of impact that you can make in the community. So on top of just your regular work, I think there's a lot of potential to make really deep, lasting impressions on the communities that we serve. And
couple of questions.
I see that if you can apply as a student, I think you have to be a graduate by the time they would hire you, if that answers your question. So with applying and hiring, the rate of return is pretty quick. That when you apply, from my experiences anyways, that I apply within a few weeks, I get notice that I have an interview, and things go, I would say, relatively quickly with the state. So unless you're going to graduate within the next week or two, I might say hold off. Typically there is an email there where you can reach out to either the recruiter or the individual that's head of that posting, that job posting, and you can ask them what are their requirements, because I do know they vary to some degree from county to county and what they are looking for and what they will take. So it doesn't hurt to ask. for that particular posting. But I want to say almost every posting that you have to be a graduate at date of hire. And maybe Doris knows more about that being a recruiter, but as my understanding is, you have to be a graduate at date of hire.
Yep. I can kind of piggyback on that. So I usually tell students that you can start applying about 30 days prior to graduation, just because usually, like Alan said, the interview process, depending on the county, is sometimes pretty quick. Some of our larger counties are in what we call a centralized hiring pool. So those, your application may sit a little bit longer just because they get a higher volume and they're doing monthly interviews, building a pool of applicants ready to go when there's a vacancy. And I can touch on this more when I get to my piece of it, but so usually about 30 days is that time frame to, by the time they interview you, do references, do the, schedule you for a drug test and get a start date scheduled. You should have your final official transcripts by that point, is how we look at it, because you have to have those final official transcripts prior to walking in the door. There was something else I was going to touch on too. I don't know. So any other questions for Alan on the position itself before I jump in with the how to apply piece? And, I'm all for having this be interactive. So if you're comfortable with unmuting your mic and jumping in and asking a question, go for it, because it's really hard as a presenter to kind of just keep talking because you feel like you're droning on and everybody's zoned out. So the more interactive this is, the easier it is for me. So just kind of keep that in mind. Don't feel like you're interrupting me at all. Before I get started, there's a couple questions.
This is Monica Singleton. I do have a question. So I do have experience with foster care. I used to work in a private agency. I am currently in my master's program. And so even with experience, what I would have to wait, even having experience to apply.
What is your bachelor's degree in?
Psychology.
No, you would not have to wait, because your bachelor's degree is a qualifying degree and we hire at a bachelor's level. Your master's level position or your master's level degree will get you a little bit higher pay rate, and it will also allow you to promote into supervision sooner if that's an avenue that you want. But we do hire at bachelor's level. So with that psychology degree, you would be eligible to apply now.
Okay, thank you.
Yep. And I think that answered the next question, where somebody asked about BSW job opportunities or MSW. We hire both. I think the majority of our new hires come in with a bachelor's level. Like I said, the master's level is a little bit higher pay scale. I think when it taps out at the very max level, it's like $2 and some change difference in pay. And then there's another question here. It says, hypothetically, if you were hired in being a part-time student, is MDHHS able to work with a person while in school? That's one of the benefits of, I think, our department is we do have a lot of flex scheduling. I'm not sure, it depends on the county. Some counties are all about it and have everybody a different flex schedules. Some counties are very strict and want people working 8 to 5. So there is some variance depending on who the county director is. But we have a lot of people that work 4 10-hour days, take that 5th day off, whether it be a Friday or Monday or whatever day you happen to have class. They also have people that work 9-hour days and take either a half day off or every other week have a full day off. We have people that work, earlier in the morning, get out earlier in the day, like maybe you work a 6 to 3 shift, something like that. So there is a lot of flexibility. We also have something called administrative leave, where a person can take, I've been out of the loop for a while, but I think it's 4 hours a pay period. And that's to actually attend class. It wouldn't be like to leave work and get to class. It would have to be in class time. And I think that's after you're done with your probationary period. And it's based on agency needs. So, your work area would have to be able to get along without you for those couple hours to be able to do that. But there is a lot of flexibility. So I think I answered that question. I did put in the chat box the website where all of our job postings are. So it's michigan.gov/MDHHS jobs. That's going to bring up all of those job postings. You're going to be looking at a services specialist for this particular job. And it is posted by county. So each county has that listed. It'll say services specialist hyphen Wayne County, services specialist hyphen Sanilac St. Clair hyphen Genesee County. I always tell people to apply to as many counties as you're willing to commute to, just because we do have those hiring pools and we do have continuous postings. So those postings are always out there, whether there's a vacancy or not, just because these are critical need positions. And when we have a vacancy, we want to be able to fill it as fast as possible. And by having those postings out there, we don't have to wait okay, we've got to get the posting ready. We've got to post it. Now we have to wait 7 days for that posting to come down. Now we're reviewing applications. This process, we're constantly reviewing applications and constantly moving people through the process. So even if it's a county that doesn't participate in that hiring pool and only interviews when they have a vacancy, we're still looking at people and sorting people and screening people in the meantime, so that when they do need us to send them candidates to look at for interview, they're ready to go. So we try and keep this as streamlined and as fast-paced as possible. I'm not sure if this will allow me. Let me go in here. I'll see if I can share my screen and I'll actually show you the job postings.
Doris, I do have a quick follow-up question.
Okay.
I know you had mentioned with bachelor's degrees, there are certain degrees that you could start working with MDHHS. Do you guys have like a list of what ones like qualify technically, or?
Yes, they are on the job posting itself.
Okay.
We have opened it up pretty substantially. It used to be like maybe 6 or 7 degree majors that would qualify. We've opened it up so like an education major would qualify. And we also, for bachelor's level, master's level has to be specific degree major. Bachelor's level, you can be any major. And as long as you have 30 credit hours in those classes, so like your psychology, human services, sociology, social work, any of those types of classes, you would qualify based on those 30 credit hours. So we've even had like a business major qualify because they probably started out wanting to do social work or psychology and then switch their degree, but they had enough of those underlying classes to qualify. So that's really helped us. But let me go here. I'm going to share my screen real quick. And I apologize because it's going to be off to the side. Now I always feel like I'm looking off crazy-eyed. Okay, so can you guys see can you see my screen?
Yeah.
Yes.
Yes.
Okay, so this is what you're going to see when you go to that michigan.gov MDHHS jobs. And as you see, it'll say current vacancies, services specialist. These are normally in alphabetical order, but those of us that post these services specialist positions have gotten smart and we'll put an asterisk in front of it or something like that to get it to the top of the list.
I think we're
So
seeing
we're
the
seeing
meeting
your Zoom
invite.
Oh, sorry. Let me move this back over here. Are you seeing it now?
Yes.
Okay.
Enlarge.
I've got multiple screens, so I didn't realize that I had to have it on the other monitor. So if you just type it in services specialist, that's going to bring up all those services specialists. And you can see they're listed by county. So we've got Marquette, Hillsdale, Lenawee, Monroe, Tuscola, Lapeer. You find the counties that you're interested in. And let me see if I can find Wayne on here. And I apologize for the background noise. My husband's in the other office on the phone. I can hear him talking. So I apologize ahead of time. So this brings up the actual application. It's going to tell you the salary range, that it's permanent, full-time. It gives a job number, and this tells you that it's a continuous posting. So that means it's always out there. So if you're looking at other positions within the department, and a lot of those will have an end date. Like, let me show you here real quick. This food industry scientist has a beginning date and an ending date. So you'll want to keep track of something you're looking at has an end date that the posting is going to come down. don't wait to apply because they don't always go out to that date. If they get a ton of applications, they may close those early. So if you see something you're interested in, apply right away. So when you pull up the posting here, it's going to tell you a little bit about the job. There is a video that we want you to watch and answer some questions based on that video. There's also a detailed position description. And then this is where the educational requirements come in. So this is telling you that it's a possession of a bachelor's or master's degree, and then it's got all of those degree majors listed here. And then it tells you experience level. There's no experience level. We hire new grads. Applications are good for 6 months. Tells you that the position is located in Wayne County. Kind of gives you a map. And that's the majority of that. The next tab here talks about our benefits, which I'll get into in just a second. And then there's questions that are attached to each job posting. So you'll want to go through and answer these questions. Now, the first one asks if you already have your bachelor's degree. So if you're applying 30 days prior to graduation, you're going to answer no to this one and yes to question number 2, saying that you're going to have your degree within 30 days. Just make sure that you answer those correctly because you don't want to have them think that you falsified your application. Then they're asking what your degree major is, just some other questions. Which position are you interested in, foster care or child protective services? They usually don't hold you to that. Usually when you interview, they a lot of times won't know where the vacancy is going to be, but when you get the job offer, they'll tell you at that point. We have had people that have said, yep.
Oh, I'm sorry. Hi, how are you?
Oh, good.
I apologize for being late, and I had forgotten I signed up for it, Lord. Okay, anyway, I apologize.
That's okay.
Okay, thank you so much. I recently graduated yesterday. Let me show you my face.
Well, congratulations.
Yeah, I was trying to show you my face. Okay. Well, anyway,
I see ya.
Oh, you see me. Oh,
Yep.
okay. Okay. I'm sitting in my car, just dropped my son off at work. But what I wanted to say was that I recently graduated yesterday. And so I will be having my BSW, but I have to get I'll be getting my limited license and then, prepared to take my full license, like maybe a year or so, studying and getting hours and experience and things like that. So would I be able to get a job, a position with my limited license for BSW or no?
Yes. We don't require the licensure. So I believe some of our county offices do have people that can supervise you if you need certain supervision to get your license, but we don't require that license to work for us.
Oh, okay. Okay, that's good. Okay, that's good. Okay, I'm gonna go back into hiding because I'm gonna drive off.
Okay.
Okay, thank you.
No problem.
Okay.
Okay. So we have had people when they've applied and they've offered the job that they've said, nope, I don't want CPS. I only want foster care. So they've declined a position and asked to stay in the pool and wait for that other position to come up. So it just depends on what your preference is. I always tell people, unless you are really hardcore set against one or the other, I would take whatever's offered, get your foot in the door, and then you can transfer within after that first year.
Doris, question.
Yep.
How long do you have to wait before you transfer to a different position?
Usually it's your probationary period, so it's a year. I'm not sure about transferring within programs within the county. I'm not sure if they hold you to the year in that also, but I know like to move, like let's say you hire in Wayne County, if you're commuting from, I don't know, Livingston County, and you want to be in Livingston County, it's a year before you can transfer. So that's why I tell people don't apply, if you don't want to move to the UP, don't apply to the UP because you can't transfer right away. So, and then the other questions, just make sure you're reading them a couple times, make sure your answers are correct. I've seen a lot of times where people will have, do you have any objection to being fingerprinted or drug tested? I've seen quite a few applications where they mark yes. My assumption is that they've read the question wrong, but that does get you screened out. So just make sure you're reading these questions and answering them accordingly. And then on the benefits tab. So with state employment, we have for a very robust 401k plan. And actually I think that's all I have here. Unless you guys have any other questions, I'm going to quit sharing my screen so that, there we go. Now I feel like I can see. So as far as benefits, we have a 401k plan. If you take advantages of all the matches that the state offers, along with there's some mandatory money that you have to put, I think it's 2% that they mandate now. But it ends up being 14% of your gross pay going into your 401k every pay period. As far as leave time, we have what we call annual leave, which is your paid time off or vacation time. And then we also have sick leave. So your annual leave, you get 16 hours when you hire in, and then you get 4 hours every 2 weeks for the first year. And then after that, it's 4.7 hours every 2 weeks. And then it goes up every 5 years from there. So myself, I've been with the department for going on 22 years. I'm getting 7.6 hours or 7.1 hours every pay period. So it does add up. Sick leave is 4 hours every 2 weeks when you hire in. That never changes. So that's 4 hours from the time you hire till you retire. It's 4 hours. Let's see, holidays, we get 12 paid holidays a year. We get election day every even year, we get election day. So 13 on those years. I talked a little bit about the alternate work schedules that we offer. Insurance and life insurance. We have what I consider phenomenal insurance packages. We offer quite a few different HMOs and Blue Cross Blue Shield straight up. There's some other, I think like lower level, high deductible type plans that you can go with now too, that they've just added. But I have an HMO. I pay, I think $150 every 2 weeks. It covers my entire family. I have like $125 deductible. I pay $20 to go to the doctor and either $10 or $20 for prescription, depending on whether it's generic or not. And talking to other people outside of state government, it's a phenomenal rate. So as far as dental insurance, we have Delta Dental, which covers just about everything. I think I pay $7 for teeth cleaning. I think I maybe pay $20, $30 to have a filling done. And that costs me about $4 every 2 weeks out of my paycheck for that insurance. Vision insurance, the state picks up the premiums for the vision insurance. They also pick up the premiums for your life insurance, unless you take a reduced rate. Unless you take a reduced rate life insurance, I believe, then you get a little bit of a kickback. But what the state offers is 2 times your salary. And we talked about retirement. Any questions on anything I've talked about?
I was going to expand on the leave and say that I don't know if it's county discretion or how that works, but there's also admin leave for job shadowing. So say you hire in for investigations, child protective services, and you really wanted foster care, you could work child protective services, investigations are ongoing, and then job shadow foster care and see if you actually would like it. And it doesn't cost you annual leave. It's just a process with your management to go through. And if you have issues getting admin leave, of course, you can take annual and then job shadow as well to actually learn additional positions and see where you'd like to grow within the state. So there's a lot of opportunity for education, secondary education within the department and growth. So
I'm going to
I
mention
look
one
at state
thing.
government kind of as, oh, go ahead.
No, go ahead. I'm delayed. Go ahead.
Go ahead, Sam. Oh, I just look at state government as kind of its own entity. Anything you can do in the private sector, you can do in state government, and kind of where you want to go with your career, sky's the limit. Even if we
Your mic is
You're on
muted.
mute.
Oops,
I think we
sorry.
might
How
have
long
lost.
was I muted?
Okay. Yeah.
I don't know how I got muted. Anyway, you can promote and move from different department, and all of your state time, seniority, all of that goes with you when you go to another department. We a lot of times will have people that hire into corrections as a corrections officer. They'll work there a few years, then they'll transfer into our specialist position because it's a promotion from that corrections officer. And then they'll work for us for a while, and then they'll promote back to corrections doing parole and probation. So those opportunities are there. We've had people that started out doing our assistance payments worker work, which is a lot of data entry, working in our county offices, processing applications for assistance. They end up being county directors. You know, they work their way through the system and become a director of the county. So sky's the limit kind of on where you want to grow your career with the state. I'll talk a little bit about the interview process. Like I said, most of our counties do bi-week or monthly interviews. If you get an interview, you will be notified whether you passed or not. They are behavioral based. So what that means, the questions are going to be phrased like, tell us about a time that you had to make a difficult decision, how you handled that, and what was the result. So they're going to be phrased like that. When they send you the email scheduling your interview, they're going to give you the competencies. And a lot of those great characteristics that Alan was talking about earlier that they look for, those are what the competencies are. So they're going to be looking for like team building, communication skills, maybe stress management, but they'll list those out for you. So what you'll want to do when you get that list of competencies is you want to start thinking about different things that you've done, whether it be in school, in your personal life, maybe in a job, that highlights that you have that competency. And I hear a lot of people say, well, I only waited tables. I don't have any pertinent experience. Waiting tables is great relevant experience to this job. You wouldn't think it would be, but you're dealing with difficult customers when you're waiting tables. You're dealing in a high, fast-paced environment. You're having to make changes quickly. You're multitasking. So, you know, a lot of that stuff is relatable. So you just kind of have to think outside the box and be able to take your experience and kind of mold it to what they're looking for. Let's see. Sam, is there anything I've missed?
One thing I wanted to touch on was when you're applying, how important it is for those official transcripts. A lot of students will attach a transcript that, you know, might not be quite official, or it might be that unofficial, and you're going to get screened out prior to even getting that chance to interview. So it's super important on those official transcripts. My internet is saying I'm unstable, so hopefully I don't cut out, but those transcripts are really key when you're applying. Okay. And then one more thing that I wanted to touch on as well. Gosh, I just lost my train of thought now. When you're answering some of the questions, when it says, do you have an objection to being fingerprinted or drug screened? Some people misread that question and then they say yes. That's another automatic screened out. So if you are okay with being drug screened, make sure you read that question and you're answering it appropriately, because we do have quite a few that will get screened out at that process as well for just kind of miscommunicating the question and how it's asked. So those are the two things that I just wanted to really stress how important it is when you're applying for these positions.
Okay. Also, kind of to touch on the internship program that she talked about in the beginning, those positions, and I'm not sure if the Wayne Collaborative, if that's if you apply for that one or not, but our unpaid internship application is out on that same website. You would type in unpaid, I think it's unpaid child welfare intern. Phenomenal internship program. We actually, non-COVID, we have you in the office actually job shadowing the workers, going along with them, doing home visits, maybe going to court, helping supervise parenting time, all of that kind of stuff. They really want you to get a hands-on feel for the job. We found that people that hire into this position that know what they're walking into, or at least I don't know if you can ever know what you're walking into, but have a good, healthy understanding of the job, tend to stay. The ones that hire in going, well, it might work, I don't know, they're the ones that maybe work a day or two and they're out the door. They're like, no, this is not for me. So the more experience we can get you and the more that you understand what the job is, the better we are. But that internship, like I said, you're working in the office. Right now, a lot of it's virtual, but our workers are trying to do, they touch base with the families virtually. They do some of that stuff. They go to court, it's virtual. They would have you log into all of that and participate along with them on those. So you're still getting a pretty good hands-on experience. One of the good things about our internship program is it does offer that streamlined hiring process. And that's up to 2 years from the completion of your internship. I believe, Sam, is it 2 years from graduation or 2 years from the intern?
It was 2 years from graduation.
Okay.
That's my understanding.
So from 2 years, okay. So if you do your internship your junior year, you would have 2 years from the time you graduate to come back and apply to us and not have to go back through that formal interview process. We have had people that have done their internship their senior year and they actually hire in and never leave the office. So they hire directly upon graduation. If you apply that you didn't intern, let's say you interned in Wayne County and you're applying to Washtenaw County, they don't necessarily have to interview you either. They can bring you in and just do a meet and greet. So by doing an internship with us, not only do you know what the job is, it also gives you kind of a heads up or head and shoulders above the other applicants, I guess is a good way to put it. Any questions?
Actually, I was
We
wondering.
covered a lot really quickly, so please feel free to throw stuff at us.
Hi, I was wondering if
Sarah,
you could.
did you have a question?
Yes, I did. Can you hear me? Hello?
Yep, you're cutting out a little bit.
Sorry. I was wondering if you can talk a little bit more. You talked about some people went into corrections and then came over to this area and then went back as parole. Would a person be able to enter in under your department and then go to parole office?
Yes, because we're different departments, but we're all under that state of Michigan umbrella. So you can transfer, if you saw a posting for a parole and probation officer, I think they require a little bit of experience, which is why it's kind of a back and forth. But you could apply for that, and usually the state employee will get precedence over somebody that's not a state employee. But like I said, all of your leave time, all of your seniority, all of that goes with you when you transfer.
Thank you.
And somebody's asking where they can find the internship again. It's on that same website. I'll put the website in here.
Did I miss when you were talking about the benefits? Did I miss did you mention tuition reimbursement at all?
We do not have tuition reimbursement any longer. We used to have it when I hired in about 20 years ago. Unfortunately, with budget cuts, that's went away. I think some of the unions still offer tuition reimbursement. So depending on if you're in a union or not, that may be a possibility. And we do work with some universities that offer discounted rates for state employees also.
I was wondering, I have one more question actually. How long is the internship?
Okay.
The unpaid?
The internship is anywhere from 400 to 600 hours. So it just kind of depends on your availability on how quickly you complete that. Sorry, I put the message in, it went into direct message instead of to everyone. So we have people that do it in a semester. We have some people that take 2 semesters because we do work around your work schedule or your school schedule to do that. And the reason we do the 400 to 600 hours is because of that streamlined hiring process. So you can do less. We've had people that have come in and done 200, but only doing 200 hours on that internship does not qualify you for that streamlined hiring process at the end, if that makes sense.
I'll maybe add, if students are thinking of doing an internship as part of their bachelor's or master's program, that has to be coordinated through our Office of Field. As Dr. LaShore mentioned earlier, that the Wayne Together Collaborative is always in collaboration with Wayne County, Michigan Department of Health and Human Services. But and so you have to meet the hours for the degree program, which are over 200 or over 400 anyway. So I think it would meet your requirements.
Yeah, which is I'm sure why we've picked those amount of hours. I think for social work, it falls right in the realm, but like psychology and criminal justice, they're like, what? You want me to do this many hours? So, any other questions? Samantha, do you want to talk about the master's level at the hospitals, the social work positions? Just so they kind of have an idea that those are out there.
Yeah, so we actually have.
I have a.
Go ahead.
Oh. Are you there?
Loser?
Apologies. I had a question. I couldn't mute myself fast enough.
Okay.
I was just, can you hear me? Hello? Stay in adult services. And I was just curious to know how foster care or child services would translate to.
Alan, I'll let you take that one. We don't usually hire for adult services. We do occasionally post for those, but most times it's a transfer in just because they're people with seniority usually want those. But I'll let you talk about how that experience relates.
I couldn't hear very
She was
well.
asking how foster care or CPS would that experience would relate into moving into the adult protective services position. Or program, I should say.
Absolutely. That's typically what they go for. When I spoke to management, is that with, like you said, adult protective services, I don't think I've seen, but maybe I have seen a couple postings for adult protective services externally directly up, but typically it is from child protective services going into adult protective services. With that, like I said, with child protective services, you have the investigative worker, the ongoing caseworker, and then the foster care. I want to say it's very similar in setup how the adult protective services works as well. In our small county here in Sanilac, we only have 3 workers, and of that, it's one worker goes out and does the initial point of contact. The other worker then looks at placement for adult facilities, and the other worker specializes more so in home help. But with that, I mean, it's all about conducting investigations, making referrals, going into court, and standing by what you've documented in your case. It almost sounded like you said about transferring from adult protective services also to child protective services. Was that correct or no? Did I mishear that?
I think she was just going the one direction.
The one direction. Okay.
I think so.
With that, because, oh, go ahead. I'm sorry.
I was answering yes.
Okay, we're going
just to adult protective services, but a lead in from either of the two into adult protective services makes sense.
Okay. Yeah, typically it is through child protective services into adult protective services. But I want to say I did see a posting not too long ago, direct hiring for adult protective services. But that I think that is rare. So
those are usually a hot commodity.
Right. Yes. And the worker that I work with now, he worked actually child probation, then he went to foster care, and now he works adult protective services, and he loves it. So I know a lot of people go from child protective services to adult protective services, and also probation and parole. I know several staff that's gone that way too. So.
Okay, thank you.
Yep. Another thing I will touch on is if you're getting your bachelor's or you have your bachelor's now and you're interested in furthering your education into a master's degree, to my understanding, there is tuition reimbursement for management level. Maybe Doris knows more about this. I have not gone after it myself because I'm not management level, but I have heard of management level tuition reimbursement, where if you have your bachelor's and you promote to a management level position, there are specific management level positions that offer tuition reimbursement. So if you want to get your master's degree after you went into the department, that's something you could look into, most definitely.
Yeah, I'm not familiar with that, but I know that there's a union for non-represented employees, which would be managers. And I know they have tuition reimbursement, so it might be through that.
Oh, okay.
MAGE, I think it's called MAGE is the union.
Yes, yeah.
Yep.
Okay, thank you both.
Yep. Okay, Sam.
Okay, can you hear me?
Yep.
Okay. So we do have 5 psychiatric hospitals located in the state. One is in Kalamazoo, one is in Northville, which is going to be our children's hospital. It's called Hawthorne Center. We also have one that is Walter Reuther down in Westland, Carroll, Michigan, and Saline, which is our forensic center. We do hire those social work master's levels. We do hire even further up for like the psychologist piece and the higher education as well for some of them. But we do have those social work positions that do work within our psychiatric hospital. So that is like that different piece that some people do kind of strive for. I know that the Hawthorne has been posting a lot of like a medical admissions social worker. They've had kind of a harder time filling those positions because I know a lot of people like that more hands-on therapeutic piece where it's more of a medical admissions administration piece to it. So there's that opportunity if you're interested in that admin piece. But we do have those positions that are located in our hospitals. I would love to offer you guys a job shadow or a tour for those positions. Unfortunately, right now with COVID, we're not able to offer any of those. But if you guys are kind of coming to terms with your master's degree at the end of it and you decide, hey, you know, COVID kind of has disappeared, hopefully, and you would like to go through like a tour or a shadow, we can also set that up just for a different opportunity if you're really interested into that mental health piece side of things. So that is another option. That those postings would also be listed where those services specialist positions are located. We have had internships in the past. Unfortunately, right now, again, those are in-person position or internships. So we haven't been able to get that approval yet, but that would also be on the website posting as well.
And I put Samantha's email in there. So if the time comes and you guys are interested in a job shadow or a tour, you can reach out to her for those psychiatric hospitals.
Hi, I have a question.
Uh-huh.
Now for the job working at the hospital, do you guys require that we have our limited license first before being able to actually apply and try to go off into that?
So some of our postings do require the limited license. It's going to depend per posting because there's some hospitals that will require it for some positions. But like I was saying about those medical admissions, they don't require it. So it would kind of be depending on the position itself within the hospital because there are those various positions for social work. So if you have a question, let's say you see a posting and you're like, hey, I really want to apply for this. And there's a question on that piece. If it's a lot of times it will state it in the posting. If it don't, and you have a question, you can reach out to me at any time and I can find out for you.
Okay, thank you.
You're welcome.
Okay, and again, that sign-in sheet was in the chat box. So if you guys haven't signed in, please go use the link and sign in for us.
First, you might throw it back in there. The way Zoom works,
Okay.
if people join late, they won't see it.
Okay, let me find it here.
And while you're doing that, I'll just throw out that, you know, and obviously this is coming from a licensed social worker. I think it's always a good idea to consider licensure it for lots of different reasons. At the very least, if folks are interested in looking at positions that require that, it'll make it a lot easier to be eligible to apply for those positions. But
Yeah.
obviously also to be connected and to demonstrate that you're prepared and working in different areas.
Do you guys offer the child welfare certificate program?
We do.
Okay.
So folks can certainly, it's a graduate, I was going to say graduate. We had talked about doing both undergrad and grad, but right now the one that we have is at the graduate level. So,
Okay.
And it's sort of connected with Dr. LaShore's comments about weighing together. I mean, students can certainly be in that program without the certificate, and they can do the certificate simultaneously
Right.
while they're in the master's program.
Yeah, which we offer if you hire in and haven't taken that class. That's part of our training, which I didn't touch on. We do 9 weeks of training. You go back and forth between your county office and either Lansing or Detroit, depending on where your training's at. If you're having to travel, we do pay your hotel, we do meal reimbursement, and we give you a state car if at all possible to travel with. But that child welfare certificate will take about 4 weeks off of your training, and it makes you a little bit more marketable when you're applying, because if it's a position we need to fill and we're looking at 2 people who are equally qualified, we're going to go, ooh, this person's going to be in our office hitting the ground 4 weeks sooner than this other person. So either way, you're going to get that training, whether you pay for it and do it through the school or you wait until you're hired. But it might help your marketability, I guess is the word I want, if you have the training already. So that's something to think about also. Okay, we're almost at 4 o'clock. Last chance for questions.
Hi, I have a question.
Uh-huh.
Will we be able to receive a copy of the recording for this meeting?
We will post it. We just have to figure out where, and I'll make sure that you all get an email. But yes, we'll have it posted so that you can access it from our website.
Thank you.
And my email, let me put my email back in here again. If you guys have any questions later on, if you walk away and go, oh, I wish I'd have asked this, feel free to reach out. That's my job, is to answer any questions that you may have. Make sure I spelled it correctly.
Also put my email if you have questions regarding the work itself, whether it's adult protective services, child protective services. You can reach out to me about specifics, and I can, if I don't know the answer, I'll reach out to management or our field agents also and get that information for you, email you back as quickly as possible. So.
Any other questions for any of our presenters, speakers? Sounds like folks found it helpful, so that's good. All right. Well, let me take a moment to thank all 3 of you for being here. We really appreciate it. We will have a much larger group of students that will be graduating in April, so perhaps we can think about doing this again for a larger group.
Yep,
so
absolutely.
Feel free to reach out. Great.
Okay.
Thanks everyone, and have a wonderful day and a wonderful holiday season.
Thank you.
Thank you.
Take care.
Thank you.
Thank you.
Thank you. Appreciate it.